Hi guys, welcome to another session. Today we'll deal with the posterior aspect of the skull as we are looking at the external features of the bony skull, right? So the posterior aspect of the skull is called as NORMA OCCIPITALIS because the main bone in the posterior view is occipital bone. When the skull is viewed from behind, it appears convex upwards on sides but flattened below. The bones seen in this view are posterior portions of the parietal bones, the upper part of occipital bone, and the mastoid parts of the temporal bone. So the parietal bone, occipital bone, and temporal bone. These are the bones that we can see when we look from the posterior aspect of the skull. See, these are the parietal bones, right? And these are the temporal bones. And this one is occipital bone. So the parietal bones superiorly on each side, occipital bone, the squamous part of occipital bone inferiorly, and the mastoid part of temporal bone infralaterally on each side. You can see that. See. So this is the posterior aspect. Okay. Norma occipitalis view. So the selected structures are parietal bones, right? And inferiorlaterally temporal bones. And this one is occipital bone. Coming to the sutures, there are lambdoid suture between occipital and two parietal bones, and occipito-mastoid suture between occipital bone and mastoid part of temporal bone, and parieto-mastoid suture that is between parietal bone and the mastoid part of temporal bone, right? See, so these are the parietal bones, and this is occipital bone, this is temporal bone. So the suture between parietal bones and temporal bone is called as parieto-mastoid suture, right? And the suture between occipital bone and temporal bone, that is mastoid part of temporal bone, is called as occipito-mastoid suture, right? So this one is lambdoid suture, right? So we have lambdoid suture, lambda, parieto-mastoid suture, and occipito-mastoid suture, right? Those are the sutures and these are the bones. Sometimes there may be an islands of bones within the suture. Okay, they are called sutural bones or Ormian bones. Okay, so these are the bones, or you can call it as island of bones within the suture. And sometimes there is a big bone between the two parietal bones. It is called as interparietal bone. So see, all of this bone is called as interparietal bone or Inca bone, right? So those are some anatomical exceptions. Okay. Other features of the norma occipitalis. So you have already know the lambda is the point where sagittal and lambdoid sutures meet, and there is a important protuberance in the norma and the posterior view. External occipital protuberance. It's a median bony projection about midway between the lambda and the foramen magnum. The most prominent point of the external occipital protuberance is called as inion. And there is superior nuchal lines. They are curved bony ridges passing laterally on each side from external occipital protuberance. In some cases, curved faint bony ridges are seen above the superior nuchal lines. They are called as highest superior nuchal lines. And then we have a feature called external occipital crest. It's a vertical ridge between the external occipital protuberance and the posterior margin of the foramen magnum. And inferior nuchal lines, these are curved bony ridges passing laterally on each side from middle of the external occipital crest. And there is one foramen called mastoid foramen. It is present near the occipitomastoid suture. Once you see these features, you can clearly understand that. So this bony projection is called as external occipital protuberance. And the lines spreading from here, right, are called as nuchal lines, right? Nuchal lines. So usually the highest one is called as superior nuchal line, superior one. And the 2.5 centimeters below it is called as inferior nuchal line. Sometimes 1 centimeter above the superior nuchal lines, there are line highest, or you can see supreme nuchal line. Okay, so this one is highest or supreme nuchal line. That is the point. Superior nuchal line, inferior nuchal line, and sometimes there is highest or supreme nuchal lines. The muscles of the neck attaches to these lines, right? These lines and occipital protuberance, and you can see the vertical ridge present here. It is called as external occipital crest. Okay, so that is crest. And as you know, this is occipitomastoid suture, and this is parietomastoid suture, right? This is occipitomastoid suture, and this is parietomastoid suture. And there will be a foramen in the mastoid bone. It is called as mastoid foramen. See here. So this is not norma occipital, this is norma basalis. Okay, so in order to understand clearly, you see the bony projection between lambda and foramen magnum. This is foramen magnum. So this is external occipital protuberance. Most prominent part of the external occipital protuberance is called as inion. Okay, inion is most prominent part within the external occipital protuberance. So there is a vertical ridge. Okay, you see, external occipital crest is a vertical ridge between the posterior margin of the foramen magnum and the external occipital protuberance. You can clearly see this ridge, right? So that is external occipital crest. So the lines, you see, superior nuchal line, and this one is inferior nuchal line. Okay, to these lines are attached the muscles of the neck. Okay, and you see the mastoid foramen, okay, usually within the occipitomastoid suture. So this is mastoid foramen, right? So that is norma occipitalis. This is the diagram which has all the features, right? Parietal bones, two parietal bones, an occipital bone, and mastoid part of temporal bones, lambda and parietomastoid suture and occipitomastoid suture, external occipital protuberance, crest, superior nuchal line, inferior nuchal line, highest or supreme nuchal line, right? and the prominent part of this is called as inion, and there is mastoid foramen. Okay, these are the you see the foramen there is the this is mastoid foramen, right? And the sutures, right? This is parieto-mastoid suture, and this one is occipito-mastoid suture, right? So those are the, you see, this is a bony projection, occipital, external occipital protuberance. I hope you understand the session well. Let me know if you have any doubts, right?